Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh and a very good morning. The title of my presentation for today is First Cluster of COVID-19 Cases in Malaysia, Public Health Response and Challenges. I would like to acknowledge all the co-authors of this paper which has been published on year 2020. COVID-19 outbreak has begun on December 2019 from Wuhan, China. And as at September 2020, during this paper submission, the pandemic has spread towards more than 200 countries from 6 continents worldwide, with reported cases of more than 27 million cases and also more than 900,000 deaths. In Malaysia, the first cluster of COVID-19 was reported on 25th of January 2020, which involved the first 3 COVID-19 cases detected. This paper will report the first COVID-19 cluster in Malaysia and public health response and management towards this cluster. The first cluster of COVID-19 cases in Malaysia involving 3 cases from the 8 listed close contact of the index cases who was visiting Singapore for holiday and subsequently visiting Malaysia. The index cases was a 66-year-old Chinese citizen from Wuhan, China, who has flight to Singapore with the other 8 family members and a single friend on 20th of January 2020. They planned to travel to Malaysia on 23rd of January 2020. But then on 21st of January 2020, the index case had developed fever and cough and subsequently visited the emergency department in Singapore General Hospitals, whereby the condition has worsened and they have been tested positive for COVID-19. The son was also admitted after developing the same symptoms on that day. So, on 23rd of January 2020, the other 8 close contact has left Singapore via land using the private tour van to Johor Bahru and check in a hotel at a theme park. The Ministry of Health Malaysia was informed by the counterparts from the Singapore that those 8 close contacts of this index case has entered Malaysia. Subsequently, the Johor State Health Departments and also the Johor Bahru District Health Department's office teams were immediately been sent to the hotel for the rapid assessment and also response. All the 8 contacts were found to be healthy without any symptoms. Their body temperatures was taken and it is normal, and the nasopharyngeal and also oropharyngeal swab was collected that time and immediately sent to the National Public Health Laboratory in Sungai Buloh for the RT-PCR test for COVID-19. And on the 25th of January 2020, 3 close contacts from those 8 close contacts were confirmed to be COVID-19 positive and subsequently were admitted to the Sungai Buloh hospitals. And the other family member of 4 with the negative result were flown home to China from the KLIA. So this is the descriptions of the results of those 8 contacts in the table 1. So public health response was initiated, and these are some of the least active outbreak control measures which has been taken by our Ministry of Health. First is the home or room surveillance for all the 8 contacts during their check-in in Johor Bahru. Body temperatures and also symptoms were monitored for at least twice a day. The nasopharyngeal swab sample were taken and sent urgently to the National Public Health Lab in Sungai Buloh. The health education and targeted advices were given, including the use of masks, cough ethics, and also hand hygiene. The home monitoring tools was provided and explained, whereby the contacts were advised to inform their health personnel if they have developed any symptoms. All the meals are delivered to their respective room by the hotel staff and placed outside the room for self-collection to minimize contact. There is no room cleaning by the housekeeping was allowed for those close contacts. The hotel managers monitored the movement of those close contact through the CCTV, and security guard was placed in front of the contact room, and the disinfections activity for all the rooms involved were carried out by the district teams, and also during after the contacts check out from the hotels. And subsequently, all the 20 healthcare personnel and also 10 hotel staff who had been involved in these containment measures has been screened, and uh, all of them are tested negative. They are subsequently being quarantined for monitoring for 14 days. Some of the public health challenges are in terms of managing the outbreak and put this close contact under surveillance. The hotel management wanted to evacuate all these close contact as soon as possible in order to avoid the media attention, and also to reduce the risk of transmission, as the hotel was fully occupied and most of the travelers are with children. The suitable place to quarantine these close contacts was difficult, and also to find due to the short notice, and especially the suitable quarantine centers to prevent the transmission of the disease, which is not yet infringed in their human rights. As the result, the contacts insist to be sent to Singapore initially, but later on, after discussion and consultation, they are agree to make the arrangement with their embassies through the travel agency and fly home directly to the KLIA. So as the conclusion, this is a case study that demonstrates the competency of the Malaysian public health authorities in containing the spread of COVID-19 in the very first cluster detected in our country, despite of facing challenges. It also highlights the importance of rapid and also effective risk communication between relevant authorities and also between the counterparts in each country in order to make the outbreak control success. So by that, this is my reference, and I thank you.